name is Marco VICECONTI, and I am the director of the Insignio Institute for In Silico Medicine, a new research institute established by the University of Sheffield and the Sheffield Teaching Hospital in the United Kingdom. In silico medicine is a developing area of bioengineering where we develop method and technology that makes possible to collect very detailed data about an individual patient, combine them with the mechanistic available knowledge about the physiology or the disease process of interest, and predict quantity that cannot be easily measured directly in the patient, quantity that are important for the clinician to take the medical decision about the patient management. In the presentation that I will make tomorrow, I will present, in general, the idea of in silico medicine, using as a guiding example a study that we conducted in collaboration with the Istituto Giannina Gaslini here in Genoa and other two pediatric hospitals in Europe. In this study, we investigate the juvenile idiopathic arthritis, a complex disease of unknown origin that affects children and that manifests a very high heterogeneity. Certain patients respond very well to a mild anti-inflammatory treatment, whereas others do not respond to the initial treatment and require much more aggressive therapy with severe side effects and with an accumulation of damage in the joint that will remain permanently impairing the life of the child. In this study, our responsibility was to test one of the three possible hypotheses, in particular the one that the difference between the children who responded to the treatment and the one who didn't was related to the anatomy or the function, in other words, to the biomechanics of the patient. In order to investigate this, we generated for 23 children a subject-specific model at each of the three controls at 0, 6, and 12 months. Overall, we produced 69 subject-specific models, and we used this model to quantify non-invasively the forces being transmitted at the joint of interest, in this case, the ankle. What we found is that the population of children with the active disease and the population of children with the inactive disease behaved in the same way. But when we use this technique to look at the individual subject, what we discover is that every different child was using a different compensatory strategy. Some were effective, and in those patients, the response to the treatment was very good, and some were ineffective. And in those patients, the response came very late or didn't come at all. So these are preliminary results, but if this result is confirmed in a phase 2 study with much greater number of patients, this could open up the possibility to do a physiotherapy that teach the children how to deal with the disease and increase their probability to heal quickly and more effectively. This is pretty much what we do in silico medicine.